Hi guys, for those of you who don't know me, my name is Alex. I'm a newly qualified nurse. I qualified in summer 2022 and I'm currently working in a neonatal intensive care unit as a neonatal nurse, and I studied children's nursing at university. Today's video is going to be all about children's nursing interview questions, so this video will be relevant for prospective children's nursing students, people who might be thinking about applying or might be applying right now. It is quite a scary time. There's a lot of things that you need to think about. Obviously you've got to think about like where you want to go to uni, if you're going to move out or stay at home, doing your research about the different interview processes, because a lot of unis have a very different interview process. Yeah, this video is just going to touch on a few examples of interview questions that you might get. So it's just going to be just giving a bit of advice from personal experience as to how to answer these questions as candidly and openly and effectively as you can. So a bit of background into my interview process just for context. For me, I applied to 5 universities, all of which obviously required an interview process. One out of those 5 I got offered an interview for, but I decided to not go because I just decided I don't want to go to that uni anymore. So for the other 4 universities, I got offered interviews for all of them. I went to all 4 of the interviews and I got offered a place for all of those universities. And obviously you whittle it down to your top 2, and then I ended up, once I got my A-level results and everything, I ended up getting into the university that I wanted to go to. So I'm very lucky. It was it wasn't an easy process because it was a lot of preparation, a lot of nerves, a lot of traveling around the country to prepare for interviews, meeting a lot of new people. Like it is quite a daunting experience, but it's really good experience, getting interview experience, and obviously I'm very lucky that I was successful because it is a very competitive course, children's nursing. It's very competitive, but yeah, so I'm just gonna get into some common questions. The first question is probably one that is the most asked question I think you would get, the most obvious question, which is probably something you would be asked in a job interview as well, when you're interviewing for newly qualified nurse or NQN jobs, when you're about to qualify. So that is, why do you want to be a children's nurse? Or they might phrase it as, why do you want to study this course at this university, or just why do you want to study this course in general? To answer this question, you just have to be open and honest. The way I like to think about it is, your interviews for university are essentially an extension of your personal statement. So before you go into your interviews, revise your personal statement. Think about what you spoke about and how you were able to successfully get across why you want to study this course, because obviously it's your personal statement that catches the eyes of the admissions people in the first place to even be able to offer you an interview. So just think about all the reasons why. Make it clear and short and concise, because obviously there's a lot of people that are interviewing. You've only got a certain amount of time, so just make sure you try to keep it as short and sweet as possible. If you have some sort of like anecdotal answer you want to give, like a story of something that happened in your life that inspired you to become a nurse, you can bring in, maybe you did some work experience that inspired you, whatever inspired you. Just be honest. It doesn't matter if it sounds cringy or cliche. You're giving your personal answer as to why you want to do this course, why you want to become a nurse. You can bring in things to do with current affairs. Obviously there's a lot going on in the nursing world at the moment, and maybe that might be something that's inspired you to, want to make a change. Anything that it is, just answer it very honestly and just show your passion. Don't necessarily use the word passion, because I think it's a very overused word when it comes to like uni applications and stuff. But as long as you can get across why you want to do it, what inspired you, maybe touching on some qualities that you have that would make you suitable for the role, then I think those will all be really great ways to answer that question. But I think it's very subjective, and it's the way you answer that question is very specific to the individual. The next question that I think is something that is quite commonly asked, and I'm pretty sure I was asked this question in one of my interviews as well, which was, how have you displayed X quality in your life or in a situation? So what I mean by this is maybe how have you displayed good communication or compassion or something like that. This is a great place to put in your knowledge and understanding of the 6 C's of nursing. If you don't know what those are, then please look them up and make yourself familiar with them, because mentioning them will be really useful for your interviews. So the 6 C's of nursing are care, compassion, competence, communication, courage, and commitment. These are obviously qualities that all nurses need to uphold and are very important qualities that kind of make up our kind of day-to-day in practice as a nurse. So making sure you have a good awareness and knowledge of what those 6 C's are and what they mean in general and what they mean to you is super important in general, and also for the interview process. If you were to be asked, how have you displayed courage in your life, for example, you could, it is a very on-the-spot question, because you've got to think of something that might have happened to you in your life. Maybe that's a good thing to pre-plan, maybe thinking of ways that you've displayed an example of each of the 6 C's, just in case that comes up. But take courage, for example. If you have an example of a story where you have shown courage in your life, it doesn't have to be related to healthcare or helping people or nursing or whatever, then you can talk about that and then bring in how that is one of the 6 C's and how that is a really integral part of nursing, and that's why you would be suitable for the role and things like that. Definitely bring that in, because it shows that you've done your kind of outside research and you know a bit more about the more specific qualities that make sure that mean that you've got what it takes to become a nurse. Another example that is similar to this is when interviewers could ask you to tell them about a time where you overcame a challenge. So that is quite a similar question. There's no kind of set questions that they will ask you in interviews. Every uni does it differently. Every uni changes their questions around all the time. So people have asked me before, like, what questions have people asked you? What are they going to ask? And it's like, I don't know, and I'm not going to tell you. And I can't obviously say everything people have asked, because that would not be fair at all. But there are very common questions that always come up, so it's important to prepare for everything. But a very common question that people do get, and that I have heard, is, tell me about a time where you overcame a challenge. Again, this is something that doesn't have to be nursing or healthcare related. It could just be anything that has happened to you. Ideally, it would be quite nice if it was something to do with maybe just like a difficult time you've had, whether it's to do with like your personal health or anything that you feel comfortable sharing. Like, don't feel like you need to overshare about your personal life. Like, tell them something that is important to you and answers their question properly, but don't feel like you need to overdo it and give a story that might be a bit too personal to you, that might evoke emotions that might make you feel uncomfortable for the rest of the interview. Just make sure that you're comfortable with the answers that you're giving. But being able to show how you can overcome a challenge is a really good thing to do. Bringing in the 6 C's again, and applying that challenge that you overcame to how that would help you in a nursing situation, or as a student in general, how that would help you to overcome the challenges of being a student nurse as well as being a qualified nurse. It's a quite nice way to end a question. Another example could be, talk about an example of teamwork that you've displayed. Obviously, teamwork is an integral part of being a healthcare professional in general, let alone a nurse. We work with all sorts of different professionals: doctors, physios, occupational therapists, healthcare assistants, nursing associates, so many different people, obviously students as well. Talking about how you've displayed teamwork, that could be within hobbies that you have, it could be with work experience, it could be at school, anything. It's a really nice way to show that you're a team player, because it's all well and good being able to display what you can do by yourself and all these skills that you have by yourself, but being able to show that you can work with other people will make you a lot more ideal for the role. And obviously, being a student nurse as well, at university you have to do a lot of group work, do a lot of things together, so it's important to be able to display that you have those skills. And then kind of related to that as well, some interview questions may include things about your kind of outside hobbies and interests that you have outside of your studies, which is important to talk about. Like if you've been playing an instrument for so many years, or you've been doing a sport, or you've been a dancer for so many years, talk about it, because that shows really good commitment. It shows that you are committed to learning something else. You've got other talents, you have certain skills that you can apply to nursing because you are able to kind of commit to something. You may be showing good teamwork because you might be part of a team, like a sports team or something. It displays confidence, say if you're a performer or something like that. Problem solving skills, like there's so many different things that you could apply to your hobbies, even if they are completely unrelated to nursing. Obviously those are quite good things to slip into your personal statement anyway, so in your interview you can just expand on that if you have mentioned it in your personal statement, because obviously the people interviewing you are very, very unlikely to know anything about you or your personal statement, obviously. So it's important to speak to this person like obviously they have never met you, they know nothing about you. So just sell yourself. Always link back everything to qualities of being a nurse, because it's showing that you can apply all your other skills to this new skill that you're about to be learning when you become a nurse. And that's very important, to be able to show those kind of transferable skills. I feel like those are some quite popular generic questions that you may or may not get asked in your different interviews from different universities when you're applying to children's nursing. There are different interview styles as well. Sometimes there may be scenario questions, there may be actors. Some universities bring in actual children that will ask you questions, and they will be looking at how you interact with them and things like that. Like it really varies, but university websites will tell you what they expect from you and what you should expect from them, so you have plenty of time to prepare and know what to expect. It can be daunting, it can be overwhelming, especially if you've not got much interview experience, which I didn't at the time, but you just have to be yourself. Don't take yourself too seriously, because you might overwhelm yourself. Just be professional, be polite. Don't overthink your answers, but make sure you take a few seconds after you've been asked a question to just gather your thoughts before you answer. Just relax, and I wish you the best of luck if you are in this part of your journey right now. Also be patient for the results. Sometimes it can take it can take days, it can take a couple of months to hear back from your interview regarding getting a place at the university. It's different for everyone, so don't think just because you're waiting longer than someone else that means that your interview was worse or that you're not going to get in. Like, just be patient, just do what you can, and that's all you can do, because whatever's meant to be is meant to be. I hope that video was helpful, and I will see you in my next one. Bye.